Welcome to the Digital Healthcare Experience, brought to you by Taylor Healthcare. Subscribe now and stay on the forefront of the digital healthcare revolution.
Hello and welcome to the Digital Healthcare Experience podcast presented by Taylor Healthcare. I'm your host, Chris Civitaris, and today we're joined by Rob Cohen, CEO of Livara Health, which specializes in value-based management for musculoskeletal conditions. Before joining Livara, Rob was CEO of Bamboo Health, leading its expansion from 25 to 45 states. He also previously served as market president at Evolent Health and held leadership roles at Healthways, WellPoint, the Walt Disney Company, and McKinsey & Company. A firm believer in the power of healthcare as a catalyst for positive change, Rob is committed to making a meaningful difference in the lives of others. Welcome, Rob. It's great to have you on the show.
Thank you, Chris. Appreciate it.
And to start, can you give us a little bit of background on yourself and the company and sort of what you do for Livara Health today?
Sure. I've been in healthcare for a little over 20 years and have been very fortunate to consistently be a little bit on the kind of leading edge of the trends in healthcare, and not by design, just by luck. That's the way it goes sometimes. Started my career really in consumer-directed healthcare, high deductible plans, HSAs, designing products for Anthem, WellPoint originally, and then Anthem post-merger, and then transitioned into value-based care originally with Healthways, which I sort of call the OG of population health. We called it disease management back then. And then moving into at Evolent and then Bamboo, as you mentioned, and then Livara. I've been at Livara a little over a year, and really pleased to be here.
It's fantastic. And again, it's great to have you. And can you talk a little bit about, for our listeners, just describe sort of the fundamental principles behind value-based care? And then I'm really interested in your viewpoints in the particular context regarding musculoskeletal conditions and how this approach can improve patient outcomes compared to some of those traditional models that we've seen in the past.
Sure. I think you can describe value-based care in a few different ways. Obviously, some common ways that you hear are sort of a transition from fee-for-service to fee-for-value. It's really about delivering incentives to providers and other entities to keep people healthy rather than simply treat them when they're sick. And that has a variety of elements to it. It's being proactive rather than reactive. It is doing the things, as I mentioned, that do keep people healthy, which physicians or others didn't necessarily get compensated for previously. It's very much of a reactive model. When you're sick, you show up at your doctor for whatever your ailment may be. If there's a procedure, if there's a consultation, there's a billing code, and they get compensated. And obviously, the belief is that the incentives are misaligned there with what the goal should be, which is obviously to prevent you from having those procedures, to prevent you from ending up in the hospital, and so on and so forth. And so if you change the incentives, if you change the compensation model, you'll drive different behaviors, both on the part of providers and patients, and get to what you want, which is better outcomes at lower costs.
And central to that model of value-based care, obviously, is return on investment. And you alluded to sort of the benefits for all of those stakeholders, all of those parties. And specifically, through the lens of kind of ROI, how can this more holistic approach, comprehensive approach in musculoskeletal care, how does that generate better outcomes for patients and cost savings for health systems?
Sure. So our approach to musculoskeletal care is a very holistic and multidisciplinary one. We strive to be the easy button, if you will, for MSK for our customers who predominantly are risk-bearing providers and health plans. And what we strive to do is be an avenue for when they have a member or a patient that is experiencing a musculoskeletal issue, rather than a physician or someone else having to make a decision, having to make a diagnosis, which is very difficult in the world of MSK if you're not a specially trained MSK physician, for example, rather than having to make a determination, well, I'm going to send this patient to PT, I'm going to send this patient for an MRI, I'm going to send this patient to an orthopedic surgeon, and it can drive a lot of waste in the system just right up front there. Maybe an MRI is not necessary at this moment anyway. Maybe PT should be tried before obviously getting to surgery, right? And all of those sorts of things. And so just by sending them to us, we have the experts on staff, all the way from surgeons to PM&R, physical medicine and rehabilitation physicians, to PTs, to certified athletic trainers, to connect patients to the right people, to make an accurate diagnosis, put patients on the right path, and then either deliver that path, because we have some virtual solutions that we deliver, or navigate them to the right path, and then continue to be a resource to the patient to make sure they get to where they need to get to. The ultimate goal is to make sure that only those patients who actually need surgery are receiving surgery, which many times is not the case today.
Right.
In the world of musculoskeletal care, making sure they get the physical therapy they need and the right protocols and so on and so forth, if that's what's called for, and just drive people to get better at the optimal path, using the optimal path, which, as I mentioned, oftentimes is not surgery, and yet that surgery may be delivered anyway. The statistics, the overall spend in musculoskeletal care per year is between 4 and 500 billion right now, trending up to 500 billion. It's typically the second or third highest spend category in any population we look at. And then the statistics sort of get worse when you start looking at some studies that suggest that 60+% of lumbar spine fusions are unnecessary.
Wow.
30% of total knee replacements may be unnecessary. And then you combine that, of course, with patient satisfaction, which typically hovers around 50%. For patients who receive those types of procedures. And so you've got this terrible combination of high cost, poor outcome, poor satisfaction, and you just want to use us to help the system, help the patients get the right type of care.
It's really interesting. So you're sort of sitting in the middle, I'll say, of like a much wider ecosystem related to sort of these conditions. To talk a little bit about sort of, if you can go into a little bit more detail for our listeners about that broader ecosystem related to MSK care and sort of where Livara specifically sits.
Sure. So I think it is accurate to say we sit in the middle a little bit. We talk about what we do in three main categories: care planning, care navigation, and care delivery. And I referenced a little bit of that care planning, which is use a combination of our experience, analytics, data, and our experts to get people on the right path through care planning. Then it's care navigation. What is the right path? At times, that the right path may be a referral directly to a provider in that patient's community or that member's community. And when we do that, it's to a high-performing specialist. So we form high-performing networks in the communities. We select the highest-performing orthos and the best-matched orthos for that patient's condition, or the right pain specialist, or whatever it might be, and navigate the patient there. Many times, though, we believe that the patient can benefit from a conservative care pathway. And so we navigate them to our own virtual conservative care program, which is a combination of coaching, virtual at-home exercise and therapy programs, and psychosocial programs. We're a big believer in the impact of psychosocial interventions for these types of conditions. So things like sleep, nutrition, mindfulness, pain psychology, these can have a big impact. And we have a program that we can put patients through right in the comfort of their own home with convenience, as I mentioned, with that coaching to support them. And then we monitor them very closely. And we even go so far as to round on patients that aren't progressing with that multidisciplinary team: a surgeon, a PT, a licensed clinical social worker. And so if they're not progressing, then we kick back into that navigation mode to say, okay, we may, perhaps the patient is not going to get better from this conservative care at home program. Maybe we need to get them some in-person PT. So we do offer hybrid PT. Or maybe we do actually need to get them to an orthopedic surgeon or other specialist in their community. And so it's that full experience. And what it ends up looking like is this infinite series of branches and paths that any single patient may follow to ultimately get to the right answer and get them better at what we believe is the, as I mentioned, lowest possible or optimal cost for optimal outcome.
Yeah, and it's really interesting. So it sounds like what you're describing, there's a pretty wide variety here. MSK conditions, it sounds like can be anything from, minor injuries to chronic conditions that we're sort of constantly managing. So I guess that begs the question, how can healthcare providers deliver personalized and scalable care that meets this huge diverse need in terms of this population while also maintaining that focus on value-based outcomes?
Well, certainly, as you mentioned, there are certain chronic conditions that may fall under the world of musculoskeletal, but may actually be treated by rheumatology, for example, in the case of arthritis or other conditions. And as far as the role we play in sitting in the middle is that's where sort of the navigation comes in, right? So there may be certain chronic conditions where we understand what a patient needs, and we just may need to get them to the right place. However, those conditions may still have a lot of either psychosocial needs associated with them, where our programs around pain psychology may help tremendously, things like that. Or they may have also a movement component where we can support what's happening with the local provider and medication, for example, to treat arthritis with certain movement programs to help with that. A similar example would be when a patient is experiencing a musculoskeletal issue that they may be receiving injections for.
Mm-hmm.
And there's sort of a couple of paths that injections can take. One is you may just get an injection, you get relief, and then you just have relief until it's time for the next injection. Well, that's not really solving anything. And so what we would say is there may be patients that at the moment are in too much pain to go through an effective exercise or therapy program. So what they need is an injection, then get into the program so they can tolerate it. And then the program is going to improve their condition such that they don't need the next injection. They're not in this endless cycle of injections. And so those are the types of things that we strive to make sure patients are receiving, such that, they, as I keep mentioning, such that they are on the right path to get better rather than this endless cycle of treatment and temporary relief.
Yeah, it's really interesting. And then the other thing that you're sort of touching on, it sounds like that, the best outcomes are sort of fostered by this combination of technology and kind of service delivery. So if you can talk a little bit about how that combination, technology and services, transforming access to care, outcomes, especially, I have to imagine that there are certain aspects of care where access to physical therapy, for example, might be somewhat limited.
Sure, absolutely. So obviously, one thing that virtual at-home physical therapy can do is improve access, as it prevents someone from having to either go somewhere or they live too far from from the nearest physical therapy location, or whatever it may be. So it opens up that access to them. It also may improve adherence, right? So if they don't face that friction of either they can't fit it into their schedule, or it's very difficult to get in, or whatever it is, they do it on their own time, their own schedule at home. So that helps tremendously. I think what we're seeing through the technology as well is that we continue to get better at mimicking the in-person experience through an at-home experience. So one example of that is computer vision, right? So we have computer vision built into the platform such that we are giving real-time feedback to the patient on whether their movements are correct, the angles at which they're moving are correct, and all of that is driven by the AI models, within the machines. And so I think what we'll see as technology continues to advance is we're able to do more and more with technology to support patients. Today, we still offer coaching, right? So every patient gets access to a coach who in our program is a certified athletic trainer and a PT. Certified athletic trainers actually have specialized capabilities that sort of PTs don't. So there's a really good combination there. And that's that support that either is just the accountability that keeps people engaged in doing their exercises, or is actually that ongoing support where that trainer may actually adjust their exercises in real time based on feedback, all those sorts of things. Well, over time, I think what we'll see is the technology will get better at doing some of the activities that the person is doing today as well. And so I think there's always a role for humans. But where we can use technology to augment the human more and more and more just means that we can have more and more touch points with the patient. We can monitor the patient more closely. We can respond to the patient more quickly. And all that does is improve adherence and improve outcomes. So I think there's a lot of promise to technology across value-based care, and particularly in MSK, to really enhance this experience.
Yeah, it's really interesting, and that notion of adherence is sort of I don't know, maybe something that gets overlooked at times. I can speak from personal experience that sometimes that's the most challenging part of it, going through sort of that journey of coming back from, whether it's an injury or whether it's managing through a chronic condition. That sort of mental fortitude, if you will, to stick with the program when you're seeing these teeny tiny sort of incremental gains along the way. Fascinating to hear how the technology and the combination of the services can help with that adherence. Just purely selfishly speaking, from my own experience, when I didn't have my wife shoving me in the back to make sure that I was going to my visits.
Exactly. It can be challenging, and it's across value-based care, whether it's someone with diabetes taking their medication and eating right,
diet, exercise programs, all that.
Exactly. Whether it's someone in MSK sticking with their training regimen, their exercise regimen, and their other therapies, it's across the board, and it's very tough. But it's necessary. And so we will always strive to make it better. It's never going to be as good as it could be. So we will always strive to make it better and better and better.
Really interesting. You touched on something else. So you've said a couple of times that Lavars is using the technology and your experience and so on and so forth to direct patients to the most appropriate care pathway for kind of where they are in their journey. I'm curious. I know that you're using a risk stratification and predictive analytical kind of process to do that. Can you talk a little bit about what's behind sort of that direction of the patient to the most appropriate path?
Sure. So we're a little bit unique in our business in that we've been around for 17 years. So we have treated over 120,000 patients across those 17 years and have done a lot of follow-up studies, independent research, peer-reviewed, claims-based studies to look at the outcomes of what we're doing, to compare approaches and to understand the right paths for patients. And so what we're doing is we're taking all of that experience and we're building it into analytic models that help us put patients on the right path based on all of that. And so it's things like a patient with a certain type of spinal stenosis. Do they or do they not need surgery? And what we've discovered over the years is that, hey, maybe not nearly as many do as we thought previously. And it's across the board and things like that. And so we're just institutionalizing, if you will, that real world experience of treating with patients into these models, which allow us to do that initial risk strat. And then we're augmenting it with the human touch, with actually connecting them to a human who has the right expertise that can then dive a little bit deeper, do his or her own assessment, and then come out with the right care pathway informed by all of that data, their judgment, all of it. And we believe that's the key to really getting people on the right path.
Yeah, it makes perfect sense. And we've a lot of healthcare organizations are looking at using machine learning and AI to enhance care delivery. And obviously, you've taken that step in terms of leveraging the machine and putting it together with sort of that traditional human analytics, so on and so forth. Why is that so important? Is that to get the patient comfortable? Is it the provider? Is it just that the machines aren't quite there yet? What's driving the importance of that combination of sort of the machine and then the traditional analytics when making decisions about specialty care like this?
Yeah, I think as you're referencing, a blend is the key today, and there's a very clear reason for that. What we're finding is that as machine learning models get more and more advanced, we are able to predict certain things with a higher degree of accuracy than we have in the past. The trade-off, though, is that what the machine often spits out is a little bit of a black box. And so what we can say is that this patient has a higher likelihood of X, but what we don't really know is why. Right? So the machine behind the scenes has taken all of this data and all of these data points, and it's figured out its own algorithm for figuring this out, and it spits out, this equation. and an answer. And so then what typically happens is when you go back to providers and you want to give them this information and you say, well, this patient is much more like a surgeon, well, why? And we can't say, right? And so that just doesn't work. It just doesn't work. And so what you need is this blend of the traditional analytics, which actually does have a little bit of the why. Well, what we know is that when we see this, and this, that's a clear indication that a patient is on. And so if we can augment that, and then with the additional learnings of the machine learning or the additional insights of the machine learning, then what we have is a little bit of a combination of higher degree of accuracy and predictability combined with a little bit of an answer of, well, here's what we're seeing and why. And so that's the reason. And I think a lot of the industry has learned that over the years when people kind of went gangbusters on machine learning and said, this is amazing. But then when we tried to apply it in the real world, we couldn't answer these basic questions of sort of like why. And so that's really what's behind it.
It's really interesting. And then, I mean, the technological advances that we're seeing in this space, I have to imagine, obviously, of course, machine learning, AI, so on and so forth. But I would imagine other technological advancements that are, impacting this space too, in terms of new surgery techniques and, new devices, things like that. So I'm curious, if you look to the future, and you sort of consider these technological advancements, what do you see having an impact on value-based care for MSK conditions?
Well, certainly on the surgery side, the surgical outcomes, yes, there's all the advancement that happens there, and obviously all of that's valuable to the extent it improves outcomes, lowers complications, makes surgery less invasive, whatever it may be. So all of that's really valuable. If you think about on sort of the surrounding infrastructure of how we support patients in this journey and all of those things, I would say in thinking about AI and maybe in addition to what I've mentioned before, but I did mention sort of augmenting the coach. Well, if you think about what's happening with large language models, making conversation with machines much more conversational and human-like, and the more we can do that and really bring that human touch through technology, I think that's really, really key. Because what we're trying to do now is we're trying to check in with patients on a regular basis. We want to know how they're doing. We want to intervene if they are not doing well. And we want to make sure that we're there when the first sign of something pops up, rather than them going down a different path. Right. So don't run to the emergency room, right? If you don't need to, don't do this, don't do that. Let us be your guide and your resource. And as I mentioned before, in order to be that at its highest level, we need to be there every moment. And a human can't be there every moment. But if they can feel like they're having an interaction with a human through a machine, then I think that has a lot of promise. And so we'll continue to work through that and continue to develop those capabilities. And then similarly on the back end, the more we can the machines can make suggestions to our own coaches and help our own coaches more quickly reach decisions about patients, then that's really, really beneficial as well. So, all of those things, a lot of it comes down to this notion of scalability, right? Which oftentimes when you hear the word scalability or the term scalability, you think about the financial benefits of scalability. But what comes along with that are the ability to impact more patients. That's really what it's about. Like how do we impact every patient with an MSK issue in the United States? Right. Like that would be the goal, right? And you can't do that without highly scalable approaches and systems. And so that's where we're trying to get to.
Yeah, it makes perfect sense. And I mean, I can also see on the outcome side, you described, hey, don't go to the emergency department, emergency room. There are, there's a better way. I have to imagine there's a converse to that too. A flip side of that coin that says you can pick up on those weak signals that might be indicating that, hey, we're not moving in the right direction. So I assume that you can also get ahead of some of those, pending issues, maybe a little bit quicker than we might be able to otherwise. Is that fair to say too?
It is. I mean, some of that is from just self-reported data from the patient we rely on. How are you feeling? How is your pain versus yesterday? Or how is your movement versus yesterday? But there are other things that can potentially happen as well, such as I referenced computer vision earlier. Well, if computer vision can actually pick up on little signals in how people are moving, that says something's different than yesterday, and that's a little bit concerning, then that's another example where I think there's a lot of potential there. So it's a good observation. And I think you see similar things in other in other areas of healthcare and other value-based care. In behavioral health, for example, there's been talk for a while of these apps that monitor basically your behavior by your app, right? Like, hey, this patient hasn't picked up their phone in 12 hours. That's really unusual. Are they going through a depressive episode? So this promise extends across a lot of different areas.
If I haven't picked up my phone in 12 hours, I'm probably in the healthiest mental state that I've been in years. So
there are both sides to it.
That's right. To wrap up, I know we're almost here at time. To wrap up, though, is there anything else that you're excited about or that you're working on that you'd like to share with the community?
Just really excited about the future for us. As I said, we've been around 17 years, but we've only been in kind of growth mode for a short period of time. And so we're this really interesting combination of this really mature company that has a really mature clinical model that we've proven has these amazing impacts on MSK quality, outcomes, and spend. And yet we are not delivering it to nearly as many people as we need to be. And so we are charging hard to kind of get the message out there. Obviously just acquire more customers that gives us access to more patients and members to really drive home that impact. So that's really what it's about for us. It's just hammering home that message and the depth of our experience. So just excited about what the future holds for us.
That's great. And where can listeners go to learn more about Livara?
Sure. So we have a website, LivaraHealth.com. We're also on LinkedIn. We have a profile of Livara Health, and those are probably the two best places. Please follow us there and reach out if you want more information.
Fantastic. Rob, thank you so much for joining us today. It was a real pleasure having you on.
Thank you.
And thank you also to our listeners. If you enjoyed the conversation, please like, share, and subscribe to help us keep growing the show. And if you'd like to learn a little more about Taylor Healthcare and the digital healthcare experience, you can go to taylor.com/digital-healthcare. That's it for today. And until next time, this is Chris Civitaris wishing you health and good cheer. Take care.
To learn more about Taylor Healthcare, please visit taylor.com/digital-healthcare. This podcast is for educational purposes only and is provided with the understanding that it does not constitute medical, legal, or financial advice or services. The Digital Healthcare Experience is produced by Naomi Schwimmer. Podcast music by Nicholas Bach.
Health literacy benefits patient and provider alike, but how can patients take control of their own care? Introducing iMed Health from Taylor Healthcare, digital tools that support patient education and health literacy. Go to imedhealth.com to learn more. Find the link in the show notes.